Hi, Jim from STYLESEAL here to discuss confusion in mask wearing. Masks can be uncomfortable. Many of us weren't used to coverings on our face. It's all about what we're used to. In Asia, mask wearing has been common for decades. They're used to them, and implementing mask dates was not an issue. However, in the US and other parts of the world, there was an unbelievably negative reaction to mask mandates. The blame for this lies squarely on the shoulders of the CDC. For decades, every flu season, the US CDC never, not once, recommended the use of masks as a tool to prevent the transmission of the flu. Never even mentioned it as an option. Strange, huh? Then, with the onset of COVID, the CDC made an amazing 180-degree about-face and told the public they must start wearing masks. No wonder there was pushback. Duh! That should have always been the guidance. Why it wasn't recommended is a good topic for another discussion. To compound the mask confusion, rather than tell us to all wear a mask to protect ourselves, the CDC told us to basically put anything on our face to reduce the transmission to protect others. Now, people are under the impression that any cover on their face will protect them from infection. That is absolutely wrong. Would a doctor or nurse wear a cloth mask into a COVID ward? Of course not. The correct instruction should have been to wear a mask that protects you from those that are infectious. The reason the CDC didn't recommend filtering masks was the lack of adequate PPE for medical personnel, who they were rightly trying to protect. Okay, fine, no problem. But tell the whole truth. Don't try to manipulate the public. A better explanation would have been that we have a shortage of PPE that are desperately needed for the medical staff, and in the interim, until supplies are increased, please wear what's available. But wear the highest protection available to protect yourself from those around you. Then the public wouldn't be confused to think they were being protected when they really weren't. As a result, now that the mandates are gone and mask supplies are not limited, people are wearing inferior masks that they think are protecting them when they're not. All because they were misinformed initially. One way to avoid this in the future is for all of us, including governments, to be better prepared in the future. Governments need to stockpile adequate supplies of PPE for emergency use, and so should each of us. When asked to mask in the interest of public health during a once-in-a-lifetime occurrence, the public should honor that request, which many selfishly rejected. When I was young, very few people wore seatbelts. They obviously saved lives and then were mandated. There was pushback initially, but after paying a few traffic tickets, people got used to them, and now they're worn without a thought, just like masks are in Asia. Asians would think it rude not to mask. Good for them. Is it really that big a deal to wear a 25-gram mask? To get that upset? Really? No one was asked to crawl through a muddy, snake-infested jungle in army boots. Just wear a simple mask when in public. But oh no, some couldn't be bothered or inconvenienced. A selfish disregard for others. They should be ashamed. Back in the day, many were asked to crawl through muddy, snake-infested jungles in army boots. They weren't asked, they were told. And they gladly did it to protect their country and their fellow citizens. Those who couldn't be bothered should be ashamed. Shame, shame, shame. We are all one society and need to work together. Give and take. Masks are for the public health and should not be a political statement. Fortunately, now that the mandates are gone, they don't have to be. Don't be selfish or a fool. Why get sick if you don't have to? At least for many of us, COVID-19 has helped us gain a better understanding of the benefits of masking, hand washing, and improved hygiene. Please stay healthy and stay safe. From STYLESEAL. Thank you.